we do want patients who undergo CAR T-cell therapy to be able to tolerate the toxicities. And so there is a functional status or a degree of comorbidity that makes this therapy unsafe. Although it's very interesting, there's such a profound difference between patients who have refractory disease and a lot of leukemia and patients that we're treating with minimal residual disease or a few percent. In that situation, the low disease situation, the toxicities are much more manageable, and I think there's a much broader tolerance for comorbidities. Let's say your shortening fraction isn't quite what it ought to be, your performance status is 40 to 50%. In a situation where you have lower disease burden, I think you can treat those patients completely safely. But if a patient has 80% blasts, at the time that they receive their CAR T cells, that patient is almost certainly going to the intensive care unit, and they have to have the reserve to be able to tolerate the therapy. Now, that is true for ALL. What's been very interesting to see is that lymphoma is much better tolerated. So with the same product, two different diseases, adult lymphoma actually has lower CRS rates and lower neurotoxicity than pediatric ALL. There's also, in my look at the data, although I'm not a lymphoma doc, there's a delta in terms of toxicity for the two different kinds of CAR T cells that are out there. So in ALL, toxicities are very similar between a CD28-based CAR like Yescarta and a 4-1BB-based CAR like Kymriah. But in lymphoma, it looks like the toxicity of the Yescarta product seems to be a little bit higher. All very short term, but can be somewhat intense. And since we have a handle on CRS, where everybody's focus is these days is on neurotoxicity, where the mechanism is not well understood and the therapies are not as clear. If you can get a patient through the 2+ weeks after they get their CAR T-cell therapy, all of these very short-term toxicities resolve, and the patient is then doing fine. But some of the patients can get quite sick along the way.